Hamstring strain, all muscle strains, I think, are pretty much the same in terms of what you would do in the early stages of it. I mean, I think it's very important for me, before you even get to the treatment side of it, is looking at how they actually injured it. And we're very fortunate, you know, when you work in professional sport, you're very fortunate to be able to see the injury happen at the time. And I think that then gives you an idea of the severity of strain that you're looking at before you even get near treating it. Now, the first stages of treatment of it are going to be very much the same, but they're going to be more prolonged the more serious the injury you're going to get. We have a couple of pieces of kit which we can get ice and compression on straight away, so everybody knows the kind of price regime that you should do in the first few days. We can, as soon as that person, you know, walks off a pitch, you can get ice onto it and compression. My own belief, I think compression is actually probably as important, if not more important, than ice anyway. So we have a machine that supplies cold water that goes through a compress, and so you get both the cold and you get the compression as well at the same time. So first thing we would do as soon as someone walks off a pitch, before I've even assessed their hamstring, is get that straight on, because at the end of the day it's not going to do them any harm. And you know, we do it for 20 minutes. If at the end of it we think, oh, they haven't done the hamstring, okay, doesn't matter. But I think the initial stages, you want to stop that bleeding as early as possible, because obviously that's what you're trying to do in those first few stages. You're trying to get out of or into the inflammation stage as quick as you can, and out the other side of it as much as you can. And so therefore, for me, that would be my first port of call. Straight away, put the game ready machine that it is on, put the machine onto the player. If you haven't got that, you know, just using a compression, and you can you know, use a compression bandage quite tight, and then use an ice bag, and then release it after about 10 minutes. So you get that initial stages of trying to stop the bleeding. That's the first thing I would do when someone comes up it. Then I would assess it, because I think, as I say, for me, you've got to get that initial stage of treatment in there first. Then we'd have assessment. Now, okay, you could say it's going to have an influence on the assessment that you do, but at the end of the day, it's definitely not going to do any harm doing that initial stage. And I think, as I say, I've tended to see better results by doing that. So what I would always say is, when you've got any kind of muscle strain, but say, for example, the hamstring, straight away, compression, straight away, get ice onto it, and then assess and see what it's like from there. A lot of in physiotherapy these days, it's got a bit out of fashion, and a lot of the electrotherapy, so using ultrasound, using laser, using pulse shortwave. Now, you know, my belief, I think if you get in those, that's when I think it works best actually, is in those first early stages. So I would personally I would do the ice and compression for sort of 24 hours. I would then think about starting to go onto ultrasound, starting to go into pulse shortwave, and then going on to laser from there. And as I say, I would tend to carry that on probably for about the first week. And then after that first week, I'd then start to tailor it down a bit, carrying on with the ice and compression right the way up until that stage, and then starting to swap into doing hot and cold to try and get some kind of flushing through of the muscle, and try and get some of the byproducts away. The waste products away from the injury. So that would be my kind of protocol on all muscle injuries. But as I say, especially with hamstrings, I think the one thing, hamstrings bleed because of the size of the muscle. You're going to get quite a lot of bleeding within the hamstring. So it's quite important that first stage and getting that right. And then, say, using the ultrasound and using the pulse shortwave again to promote and get through this inflammation stage. I don't tend to massage too early on within the injury. You've got bleeding there, so I think you've got to be a little bit careful that you're not going to promote that and make that even worse. And the second thing is, it's quite sore, especially if you do a hamstring injury of any note. It can actually be quite tender to touch. So the only thing I would ever do in terms of massages in the first few days is very light effleurage, and I mean very light, just to try and take some of the waste products away, and try and just break up some of that clot that's forming in terms of within the muscle. But as I say, I tend to steer a little bit, you know, I don't do too much of it in those early stages, and then gradually build it and build it and build it and build it. Because eventually you are going to need to do it quite hard. You're going to need to get into the scar that gets formed and make it a good quality scar. Because in terms of, obviously, with a muscle injury, you're going to get a scar formation, And that's going to be the same scar as it is for pretty much any other connective tissue. So what we've got to do is you've got to try and model it and get it in the right shape and the right form so that it acts like a muscle later on. So it's quite important massage as you go along, but in those early stages, I think I would tend to just leave it and probably wait till probably 4 or 5 days before I do anything and go and do that.